Now, let me go all the way back to my back injury. When did my back injury start, my disc problem? When I was in second grade at Washington Street School, I think I was late for school, and the second grade class was down in the basement, so I was going down those big concrete steel steps, and I slipped and landed right on the edge of the step, right on my back here. And I saw stars, and I was crying, and blah, blah. And I think that's when my back problem started. So you can see how all these jolts build up. And the reason why I tell you that is because as I develop this talk, I want you to understand how strains and sprains to your life, from your life, start to either be repetitive or cumulative. And we'll get to what that, again, in a second. So let me just show you this real quickly. This is the anatomy of the spine. I'm going to speak very quickly. So when the baby's in the womb, the baby's in a C curve. When the baby comes out, the first thing it does is it learns how to lift its head up, like this. And that forms the neck curve. And then the next thing the baby starts to do is starts to walk, and that forms the lower back curve. So in order to be balanced, when we look at you from the side view, you have a curve in your neck, a curve in your lower back, a reverse curve between your shoulder blades, and then you have a curve down here in your pelvis at the sacrum and the pelvis. So that gives you balance. 2 curves forwards, 2 curves backwards. Now when we look at you from the front, this is the front of the spine with your pelvis, and then this would be the back where you feel those little ridges. So this is supposed to be in alignment. You see that? That should be in alignment, but you should have curves like this to absorb shock and pressure and whatever. And the body is designed with these discs in between as shock absorbers, and also helps to maintain the posture. And then you have your movement back here. These are the joints right here, these 2 joints. Okay? So you have a 3-pronged stool. You got the disc in the front and the 2 discs in the back, and everything has to glide and move like that. Now, I'll teach you a little secret. The key to good health is being able to be flexible enough so that this can move any joint, your elbow, your shoulders, your hands, your knees, your hips, your pelvis, or your spine, all your shoulders, all your joints have to be able to move properly without restriction so that the water can get pumped back into the joint. So we call that rehydration, meaning fluid being pumped in, because the joints are 75% water. Your brain is 75% water, your body is at least 70% water, the discs are 80% water. Now, here's the key. If you get sprained and strained, and your spine from all of these things, has been knocked out of position like this, or curvature, scoliosis, whiplash, and you do not have proper flexibility, what we call range of motion, the proper motion, the body cannot pump the fluid back into the joints the way it's supposed to. Does that make sense? Mm-hmm. So, the more you're restricted in a joint, the less water is being pumped back into the joint, the faster that joint will start to dry out, what we call degenerate. And that's what we call a degenerated disc, when it's supposed to be plump, and now it's squished. So now when you start to develop that, I'm going to draw you some diagrams of how arthritis develops. Because arthritis is the compensation. Remember, the body will always try to compensate and adapt. So if your body has too much virus or bacteria in it, what happens? You get a fever. That's the body's way of trying to kill the virus and the bacteria. But what do? We try to block the body from having the fever because it's uncomfortable. In the meantime, it's trying to kill the virus and the bacteria. Okay, so, are you all with me so far?
So far.
Okay, so that's the physical part. And here's the little added extra I'm giving you all, because it's more than just accidents, injuries, and cumulative stress. But you can accumulate stress emotionally. So the more things get piled on you, taking care of your kids, taking care of your parents, work, worrying about money, having trouble with your husband or your wife, whatever stresses are accumulating on you. And then we have a study now that shows that you can only handle so much stress before you have an emotional breakdown. They say that if you accumulate 300 points of stress in a short period of time, it can cause a nervous breakdown. So what would 300 points be? Well, getting a divorce is 100 points. Losing your job is 80 points. All right? So you can very quickly, if a couple bad things happen to you, your mind can be very fragile due to accumulative stress mentally, and Of course, depression, because we know now that when you have stress, too much stress produces hormones, and those hormones can cause depression. So hormones can be good for you, but they can be bad also. So when we talk about pain, pain can come from physical stresses, mental stress, because what happens when you get mentally stressed, you get tight, right? Don't you get tense? Well, the muscles are what are holding all your joints in place. So now if your muscles start to go like this, you're going to start to have some problems. Now, chemical stress is harder to understand, but let me try to make it simple. Chemical stress, again, is when you are taking things into your body chemically, and your body is a series of chemical reactions, and the body has to be able to compensate and adapt and adjust and stay in balance. So when you have a blood test, it's supposed to be normal. If it's too high or it's too low, they say you have a problem, right? Your pH in your body shouldn't be too high, you shouldn't be acid, you shouldn't be alkaline. Now, it's the same thing with your conditions. I may be getting ahead of myself a little, but when you're normal, you do not have a condition. But if you can either have high blood pressure or you can have low blood pressure. You can either have constipation or you can have diarrhea. You can have a hyperthyroid or a hypothyroid, meaning overactive or underactive, right? So chemical stresses, when it overloads the body, will lead to these kinds of reactions, leading to asthma, allergies, cancer, because we know when the body's immune system drops due to the stress, it becomes susceptible. Diabetes. Now, let me explain diabetes, cirrhosis. You can tolerate a shot or two of alcohol. If you drink the whole bottle, what's it going to do to you? It can kill you. Why? Because those chemical reactions, that's overpowering the body so fast, the body cannot respond quickly enough within a couple hours, and it'll kill you. The same cirrhosis could take longer. You can keep drinking and drinking and drinking, but eventually, after 20 or 30 years, that organ is going to wear out prematurely. And now we find out that the same thing is happening with the pancreas with diabetes due to too much sugar and other foods, but primarily it's the sugar. And the reason why I say this is because it's stress. It's chemical stress on the body. Now again, if you take prescriptions, you could take 1 or 2 pills like you're supposed to. But if you take the whole bottle of pills, it's going to kill you. Again, you're overpowering the body. So, you can overpower the body with a car accident, or with a fall. You can overpower the body with losing your job and getting divorced and going bankrupt or whatever. And you can create chemical stress. And the body has to absorb all of these things. So it's not just physical. Now, we call that the onion peel theory. Okay? Because an onion starts off as a little kernel, and then it gets one leaf and another leaf and another leaf and another leaf. Those are layers of accumulated stress. And then you wonder why you break down and get sick. So, what we want to try to do is see if we can't unpeel those layers of stress. So, let's look at the first sheet that I gave you. After that page there, the lecture page. The first thing I gave you is something that could save your life or somebody else's life. Because we just said that stress, emotional stress, can cause a heart attack, and we know heart attacks can also be caused by chemical reactions in the body. And if you read that very carefully and pass that along to your friends, that's a very simple technique that you can use for yourself or somebody else. If you can't give them CPR or you can't get CPR to yourself, they've got 10 seconds to institute taking a breath if they can, and then coughing real hard and repeating it every 2 seconds, and they will be inflating their lungs and expiring, and it's like doing the compressions on the chest. And this is something that's new. I had never heard about it, and I've been in practice for 30 years, but I included it in the last couple of weeks because I think it's so dramatic. So you read through that. That's a little extra that I'm giving to you that can really save your life or somebody else's as it relates to stress. Now let's go to the next page.